A $3.4 million cut in state funding for homeless shelters in Lane County will likely mean several shelters shutting down and more people without access to shelter beds this fiscal year, according to the county's Human Services Division. Lane County anticipated receiving $11 million in state funding but received $7.6 million. Lane County Homelessness and Community Action Manager James Ewell said.
We have a reduction of about 60 shelter beds currently. 3 shelter programs will not be receiving shelter funding this year from us for state funding because of these reductions. We've seen about 33 full-time employees be either let go or moved to other employment within their agencies.
The state contacted the county in May of 2024 to get a report on all shelter beds being operated in Lane County. But Ewell said since then, the state hasn't been in contact to update numbers for the 2025 fiscal year.
So the information that they had via that document was outdated information. And so we were not able to provide the most up-to-date information, which reflected an increase in shelter beds between the time they sent that document and when they determined the allocation for our community.
The deficit forced them to focus on running the shelters over individual case management, making it harder for homeless people to transition out of shelters, according to Ewell.
Shelter providers have had to reduce case management staff to ensure that they can keep as many beds as open as possible. What that ultimately will mean is likely fewer folks will transition out of shelters and into their own housing because there won't be that level of intensive case management to help support them with seeking employment or learning, skills related to renting.
Based on this year's point-in-time count, just over 3,500 people were experiencing homelessness in Lane County, and most receive housing services. As of now, 3 shelter locations are expected to close, but Ewell says all 3 are working to remain open using other funding. What can the county do when state funding is cut so drastically?
I think it really means that we as a community need to look inward and find ways that we can support the services that are important to us. And so, whether that be looking to, private business entities as funders or looking to partnerships that may be able to be made with the medical system or other, provider entities.
Lane County acts as the continuum of care, the conduit for federal and state money used to fund local providers, who then offer housing, shelter, and street outreach services to the homeless. In Lane County, I'm Gold Meadows.